If I transfer good embryos, I will get result. If I transfer bad embryos, I will not get result. It's not like that at all. So always think positively, improve the quality, then aim for the quantity. This is very, very vital information. Always accept everything. Don't regret for anything. That is the most important thing you have to keep in your mind. So yet another 21st topic is a little sensitive topic. More couples nowadays facing this problem. Low or poor embryos. See, there are two cons. Low embryos and poor embryos. Now we have to make an clarity how to move forward. See, I already briefed about these embryos in some of the previous topics. Now I'll make you understand. If you are seeing an embryo which is growing on day 2, day 3, day 4. Say what I said. Initially, first day we call it as a zygote. Second day we make it as 4-cell embryo, 8-cell embryo. Third day it becomes 16 to 32-cell embryo. Fourth day it becomes compaction and morula. Fifth day it becomes a blastocyst. This is the progress of an embryo, human embryo. Okay, if you are seeing an embryo of day 2 which is 16 cell or say 16 cell, if you see that same embryo on the third day on 16th cell stage, it means that embryo is not grown further. In 24 hours, the embryo is maintaining the same stage. That means the embryo is not alive. The embryo is arrested. Now you understand this point? So it's called embryo arrest. If at any time in a given span of 24 hours, if the embryo has not evolved or grown or not gone to the next level, say if it is 16 cell, if you see next day it should be 32 cells. That is called normal growth. If it is something like 24 cells, it is a slow growth or a delayed growth. At least there is a growth. But if it is no growth, means it is embryo arrest. So when there is an embryo arrest, there is no use in transferring that embryos to the couples, to the female partner. So this is one thing, you keep it in your mind. Secondly, poor embryos. Say I told you in the previous talks about this embryo quality. A grade means good embryos, B grade means average embryos, C grade means poor embryos or low quality embryos. So there is nothing like a fixed rule, thumb of rule. If I transfer good embryos, I will get result. If I transfer bad embryos, I will not get result. It's not like that at all. We have seen failures in good embryos. We have seen success in bad embryos. So this is the point to be kept in your mind. Just don't get anything, be open-minded. Accept every result. Make every trial and errors, because you are having an average or a low, poor quality embryos, and with the negative mindset, you should not get that embryo transferred to you. The embryo, any procedure when you are doing, even if you feel so, it is not going to give that desired outcome. Understand this point. Beyond your thoughts, beyond your imagination, miracles can happen. That is why the term is called miracle. It is something beyond your thought. So why it can't happen? Have you not heard of medical miracle? Why that medical miracle cannot happen in your life? That is the way you should think, be positive. I am just going to be completely surrendered. My embryos are average or poor quality, B or C grade, still I will complete the transfer. Let me see what is the result. If the result happens, well and good. If the result doesn't happen, it is even more well and good. Because getting that result will give bad impact in the future. Think everything in that way. So always, when you are moving positively, that is the most important criteria. So in this, what we have to understand is, if you are having a poor or a low number of embryos, what are we supposed to do? The most important thing is, when the embryos are poor or low in numbers, the next thing you have to do is, you have to work for it to increase the quality. Don't think of the quantity at all. Always a sperm, a egg can give an embryo. So this is something we need to keep in our mind. So always think positively, improve the quality, then aim for the quantity. This is very, very vital information. You are having an embryo. What does an embryo mean? An embryo is going to become a baby. And a baby, when it is get implanted in the uterus, will come as a healthy baby. That's all. Embryo itself is a baby, no? So what is that preventing from that embryo to become implanted? So we have to think in that ways. So always, if you are getting embryos, think positive. Okay, I'm able to make an embryo. That is the first positive step. Then how to make that embryo give a positive result after transferring it to the uterus. So that is the second step. So this is the way we have to climb the ladder. So when you are having embryo, you will be happy. Always accept everything. Don't regret for anything. That is the most important thing you have to keep in your mind. If you have that positive mindset, then rest thing will happen in the life. If you have a poor or a low number of embryos, you have to do a checklist. Male partner, what are all the risk factors? Lifestyle, habits, food, medications, any disorders, all these things has to be noted down. Male partner, what is the problem? Female partner, what is the problem? What is a combined problem? So if you are going to do everything will happen. Your embryos will become, bad embryos will become good embryos. Over a period of time, if you are very determined, if you are very dedicated, you will even see the number of embryos also will increase. So that is why one thing cannot be reversed. In my earlier speech, I used to say, age cannot be reversed. Say for example, if you are born in 1980, in 2020 you will be 40. There is no change. That is called chronological age. That is irreversible. There is one more age is called biological age. At the age of 40, if you look like 20, that is possible. That is biological age. So, if age can be made through anti-aging, you can reduce your age. Why can't you improve your embryos? So, this is something in your hand. So, there is nothing like irreversible. Everything can be reversed. Whether it is habits or lifestyle or disease. When you are able to reverse diabetes, so many treatments started coming up for reversing the diabetes. Why can't we reverse the fertility? After all, fertility is a very minor component. Physical, mental, social health, emotional health, psychological health, all these health have got deranged. Then only the fertility health will get deferred. So when the fertility health is affected, already all the other health has been upset. So if you don't have what to do, always understand this and keep in your mind. Make things change. Baby is a byproduct and a secondary. The primary is your health. So you have to restore your fertility health. To restore your fertility health, you need to improve all the other healths. Maybe it's a physical, mental, all the health has to be restored. So then automatically your fertility health will be restored. If your fertility health is restored, and that is a solution for your poor and low embryos. So now you got the answer. Once again, it goes back to square one. Uncompromised couple preparation. It is a tough, yet I made it sweet for you all. And it is easy. Nothing is going to be difficult. Everything is possible. Only we need to have that mindset. After all, you have to work hard to achieve something unimaginable. So you work hard to get back your health. And that is a solution. If you are going to see a baby of your own texture, your baby is a naughty baby, like how you are in your childhood days, you are going to same that replica and you are going to be in your child. How you are going to enjoy after seeing that baby? See that naughty kid, it is looking like me. All the mischievous things what I have done in my childhood is being replicated here. So it is a way of happiness. So that for that you need to work hardly. That is uncompromised couple preparation, and that is possible. So with that positive mindset, accept low or poor embryos and try to reverse it. See you in 22nd point.